Lockdown in Italy. In South Korea, only a few thousand. Tina Park is a Canadian, and she works for the Centre for Responsibility to Protect and has lived in both countries, and she joins us now with her insights. Tina, good to have you on the show again. Let's talk about South Korea. Let's talk about South Korea. They've been praised for the way that it has handled the outbreak, especially around the testing. Can you tell us about why they seem to have been successful without having a mass lockdown?
So the case of South Korea is very interesting because when the outbreak first happened, we were so worried about the rapid spread. But in fact, what was happening, John, was that the diagnosis system in South Korea was so advanced that people were just being tested more. So far, about 260,000 South Koreans have been tested for coronavirus. And the way it works is that because it's free, South Koreans have very easy access to one of the testing centers, and they could even drive through if they so wish, and they would be notified within 5 to 6 hours of testing with about 98% of accuracy. And once they're diagnosed, they're either notified on their phone or treated immediately. So what has happened is that the South Korean government collaborated very closely with private companies and labs, and the results are sent to one of 96 testing labs. And as soon as you find out what is happening with the particular patient, so let's say this person is diagnosed with COVID-19, then the government uses all the possible technology. So that includes GPS tracking, using credit card history, as well as telephone records to trace where this particular person has been. So my mom in Korea, for instance, could find out exactly where somebody from her neighborhood who's been diagnosed positive has been through that day and avoid those areas. And this kind of approach has been very effective in early diagnosis and isolation in South Korea, which we're not seeing in Italy.
Tina, you have, of course, plenty of family in South Korea. What are you hearing from them about what daily life is like there?
Well, first of all, a very noticeable difference in everyday life for South Koreans is that all social gatherings have been canceled. And this has been the case for about 3 weeks now. And South Koreans are mostly working from home, so public areas are not only regularly disinfected, but generally empty. We also know that in Korea, there is a very strong culture in the public to comply with government's policies and approaches. So the Korean Center for Disease Control sends regular updates. It used to be 2 press briefings per day and 3 alerts. Now it's about 1 press briefing a day, and everybody in Korea could easily access the mapping of infected patients and quarantine cases, as well as what they should do if they exhibit any symptoms.
Now, Tina, you've been able to, of course, not only live in South Korea, but also live in Italy, and comparisons are being made by the way it's been handled there separately and the increase in the number of patients. So let's talk about Italy. How would you compare, to your knowledge, about their approach to the outbreak?
So, John, it's very unfortunate what's been happening in Italy because Italy was very late to declare the situation as emergency. And what they did in Korea was not followed in Italy in the sense that early diagnosis simply wasn't there. So to this day, in Italy, 61 million people are in a lockdown situation. And the number of deaths in Italy is about 1,000, whereas it's only about 67 in Korea. And that has a lot to do with failed testing or lack of access to testing facilities. So far, only 73,000 people have been tested in Italy. And, just locking down areas and facilities when a lot of people are infected doesn't really help contain the virus. What would have been really helpful is to have a very coherent method for early diagnosis and have a very clear line of communication. In the Italian case, the government miscommunicated a few times, which just helped with the public fear and paranoia. And right now, a lot of people who should be tested are not tested simply because they don't have the infrastructure to support that.
Tina, thanks again for your being on the show and your knowledge. Really appreciate it.
Thank you, John.
Tina Park is from the Canadian Centre for the Responsibility